Hello. Good evening, everyone. So, welcome to another sessions of Supermind Live Academy and Mastery Weekly Facebook Live. So, I'm your host today, Leslie Chong, and kindly give me a one if you can hear my audio clearly, so that we can know the audio is working okay before we invite our Dr. Alison Tan to share her experience and stuff regarding COVID-19. No? So do let me know if you can hear me clearly, so that I can see the interaction is there. Okay. At the same time, please help us to like and share today's video so that more friends can benefit from her experience and how to treat COVID-19. So during this challenging time, and at the same time today I think we have new record, okay, to 20,000. Okay, so it's a it's a good time to know more about this, because I think our figure keep getting higher and higher. So this is something which you want to know more about. Okay, so before we start, so let me invite Dr. Peter Yee to share few words, okay, before we start our session. Yes, Dr. Peter.
Yes, Leslie, thank you. Can you hear me?
Yes, I can hear you.
Can you hear me?
Yes,
Okay,
yes.
thank you. Okay, tonight it's a very special invitation. We invite Dr. Alison Tan to share her experience on how to prevent and treat COVID-19. She has been treating COVID-19 patients for recently, for the past few weeks, very successfully. I think she told me she has successfully treated about more than 50 or 60 patients. So she's very excited to share her experience with you all. Hopefully, it may save lives. That is her intention, no other intention. That's how I pass back to Leslie.
Yes. I think recently, I think we have some friends. I think recently went to we saw on Facebook Live, and then he's, I think, been in the hospital for 9 days. After that, luckily he was safe. So he's quite young. I think 30 something only. So and then at the time, I think he was planning, say, since I really get COVID-19. He wanted to go into the private hospital. So he's called all the hospital, I think private hospital, and then he's preparing cash to, I think, money to pay lah. So I think if I can go in, then I can pay lah, something like that. So then unfortunately, I think no back for him, because when he go in and then everything is full. Even though I think he got money to prepare to pay 7 figure, okay, but I think it's no back due to the high cases in Malaysia. So this one is something now. Prevention is better. Okay, also knowing some experience and information definitely can help you. I think, even though I think most of us, I think in Klang Valley, I can see more of my friends is already getting at least their first jab. Okay, first dose of vaccine, but I think vaccines still not enough lah. So I think we have Corinne. So maybe I ask Corinne to come in first. Hi, Corinne.
Hello, hi, good evening. Good to see you again. It's Thursday. Yeah, this is a very, very important topic. So I would urge you, to have a kind soul and fingers. Okay, kind soul and fingers to share this FB Live to every of your friends and family members, because it is very hard to get a medical doctor with 30-40 years experience to talk about, okay, because we don't access to specialists from a private hospitals or government hospitals to talk or to share with us about COVID. And the general practitioners, the GP has been helping out with COVID. Okay, so what us laymen, the front liner, the frontier general practitioner is the clinic that you can access to. That means we are talking about practicality here. Not to say until you're very critical that you need an ambulance, okay? So tonight discussion is extremely, extremely important. Do you mind just to help us to like and share to more people so that it will benefit more people? Even after this FB Live sections, do help us to like and share to more groups so that more people will be benefit from the preventions and the early recovery of COVID. Okay, thank you. Pass back to Leslie.
Yes, yes, yes. I think you can. What you can do, I think, is like, I think, like the video and also tag your friends. Okay, and then also to share lah. So the easiest share to different groups. So that I think today's topic is extremely, extremely important. And then we have higher and higher numbers. So I think nowadays is whether when I think after you see the mice chatra, I think outside here your 1 kilometer my one, I think this afternoon I checked is few hundred. So it's very getting serious. So knowing this kind of information is extremely important. Okay, so not waste any time. So I invite Dr. Alison Tan to. Hello, Dr. Alison.
Hi,
Yes,
glad to be
yes.
back again.
Yes, I think we miss you. I think we have been some time. I think you've been busy saving life nowadays at the moment. Okay. So I think maybe before we start, maybe we
Patients
have
are
you.
my teachers. My
Yes,
patients are my teachers. They
yes,
teach
yes.
me a lot about COVID. That's the
Hmm.
first thing. Yeah.
Oh,
COVID, in fact, is a global disaster.
hmm.
Yeah, global
Everyone
disaster.
are affected by it. So whether we like it or not, being a general practitioner in the clinic, we will see patients with COVID asking for help. So whether I like it or not, I have to equip myself internationally through learning from those well-known doctors who have a very good track records in dealing with COVID. And all of them are physicians. Some physicians turn homeopathic. So as I share, you will know that COVID infection is a virus. So when come to virus, there's no one particular drug is useful. You need to combine in order to see result. So let me start with my personal experience. In year 2019, November, when we started to know that there's this COVID SARS-2 started in China, my clinic suddenly cough cold patient disappeared. I was very amazed. No one seemed to be down with cough cold. I suppose they're too scared to come to clinic. Really, I see patients, but there's no cough cold patient for me to see then. I suppose when they have a bit of throat troubles, they normally end up in pharmacies because they're too scared to see us. Whenever we do the test positive, then they have to send for quarantine, things like that, I think lah. So actually the whole scenario lasted for nearly about 9 months. Then suddenly, last year, August, I really see so many cough cold patients. And all come in a very different variety of severity and symptom. And they can start from throat symptom, nose symptom, lung symptom, or temperature, or they will tell you they have shortness of breath, or some they say they have loss of scent, loss of taste, or some even they present with some bowel symptom. They have diarrhea, they have vomiting, together with other upper tract infection symptoms. So that is the challenge I face. I remember my first COVID patient very clearly. There was last year, somewhere around August. This Malay young man, he dropped into my clinic. He had his first vaccination. Following that, the next day, he developed fever. He thought it must be due to vaccine. And then, but the fever didn't clear off. It lasted until 5 days. So he was feeling so tired and lethargic. He couldn't eat. He ended up in my clinic. But that time, I already started preparing my clinic. Cases with fever, they have to see me at the isolation room. So I have a separate area to see people with suspected COVID. They are not allowed to enter my main consultation room. So when I put him at the isolation room, the first thing I did was full blood picture, because he has fever for 5 days. And then it turned out what, his platelet was so low, 50,000. Can you imagine? Our normal platelet level is at least 130 and above to 400. His one is 50,000. So in my mind, I was thinking, could he be having dengue day 5? Or is it really COVID, which I refuse to accept? Anyway, because of his full blood count, his platelet is so low, I have to refer him to Hospital Selayang. True enough, the next 2 days, the family member of this patient called up, warned me that he said his father actually down with COVID infection. So you see, this COVID virus, it affects your platelet count. It act like dengue. It mimic dengue sometimes. So I do have experience with quite many patients subsequently. Platelet count do come down to a certain level, but not as low as this guy. Probably he's already been suffering for 5 days. That's why his platelet is very low. Then subsequently, the one that really amazed me, really there are many type of patients that come in, they present like dengue, They will have very high fever, their whole body is very achy. The moment they see you, they couldn't sit still. You can really see they are in distress. They cannot sit, they cannot lie, and the temperature is sky high. So cases present like that. There are also cases presented that I have seen. My autoimmune disease patient. That means they have some other chronic diseases and they end up with fever. I have to treat as COVID, whether the PCR test is positive or negative, I will still have to treat as COVID. And of course, cases like this, I have to be very careful. I need to do serial blood test for her. So from cases like this or any other COVID cases, I will have a certain plan for them. But basically, the rule is multi-regime treatment. It cannot be just one type of treatment to stop the viral replication, to stop the allergy symptom, to reduce the toxic load, to reduce the oxidation in the body, increase circulation, reduce inflammation, and then later is the recovery support. So to most of the cases, especially those a bit more than the usual patients, I use this method. It is a combination of many things. And I still remember there is one very senior ladies, very malnourished, hypertensive, husband just passed away. Just after the ceremony, the son ended up with fever. First, I saw the son. And then the mom, 2 days prior to that, had vaccination. So mom had a little bit fever. I thought could be due to the vaccine. So I started treating the son with all these multi-regime kind of treatments. Later I will share more about it. What happened is the son recovered well. Subsequent mom also actually contacted COVID because the antibody not enough time to build the antibody with the vaccine. She already contacted the COVID. But cases like this, when they are a bit malnourished, they are over exhaustion over the certain ceremonies, we really have to look more. Other than just now I mentioned, I even have to seek for homeopathic medicine. That I find is of help lah. So I get to know some of the medical doctors who turn into homeopathy. So I use some of their solution to support the body. So thank God lah, she managed to come out in 14 days, in 21 days. And I also encounter most of the cases are quite easy to manage lah. As long as they are a bit younger, they don't have so much of comorbidity. The treatment is quite straightforward. But lately, there's this patient which is a bit challenging. They come with very funny symptoms. They have some indigestion. That's why sometimes we really have to listen to patient. It comes with some abnormal, it's not the throat troubles, but more into the gut issue. Started with the indigestion, no appetite to eat, very grumbling tummy, very tired. Just not normal self. That also we have to suspect whether it's COVID or not. Because she has taken FLCCC prophylaxis protocol. That means the disease is already modified. So it's not this very frank case, start with fever lah, throat irritation lah, lost taste. She just present with abdominal discomfort, no appetite, Then from the story I listened, it's already 8 days, Then I use this COVID regime and she come out happily. So sometimes storytellers, she used the saliva test, the throat test for COVID, negative. See? So sometimes we have to be very alert, especially at this time, during this pandemic time. Many COVID patients coming with different presentation. That is another issue. And again, the last patient, most of the patients, they are quite straightforward. This is another patient. She had some challenge physically. She's down with cancer, malignancy. So every time before she go for all these major life trauma, either is chemotherapy or surgery, 1 week in advance, you come into my clinic for intravenous nutritional therapy. We call Mayer's cocktail, which I learned some time ago. Just to boost out her body system so that she can stand the external stress onto the body. Each time she did that, the side effect become very minimum. So when she saw me the last time, that was I think about 2 weeks ago, she was about to go for a surgery to remove part of one of the growth in her breast. So as usual, I put her up on the intravenous drip. And towards the end of the drip, she told me, "My dear doctor," he said, "last night I felt very uneasy. My whole body was achy." Oh, I was in my mind, could it be fever? So I really checked her temperature, you see. But I'm using the oral one. Oral one is actually much more sensitive. And it came out, oh my dear, it's 38. So I'm sitting with a COVID patient for 2.5 hours in my room. And true enough, she went back, she did a throat swab, the PCR was positive. But this lady was fortunate enough because she was given high dose vitamin C intravenously. So that first intravenous vitamin C actually had helped her to reduce the load of the virus in her body. So she went through it. The moment when I know she has temperature, I put out all her multi-regime. Today I call her, she's so much better. So you see people who are actually very immune compromised, down with certain chronic disease, they can go through it. So we too, all of us can go through it. But it's just that you have to have a plan. You need to be calm, know what you are doing. When you treat early, nearly 90%, 95%, there is no hospitalization needed. So let me start with the story of this new disease. Because we all frontliner, there's no textbook, on how to treat this disease. There's no textbook. We among doctors are fighting, arguing, how to manage this case. See, all over the world now, the moment when your test is positive, the first thing they will tell you is quarantine. Isolate yourself. When you have difficulty in breathing, then you go to hospital. That is the general norm. There is no proper guideline now. So we are in the world now fighting with each other, among doctors. We have to use our own understanding, our judgment to see how to manage our COVID patient is very new. So what happened is, I actually fortunate lah. I must thank Jesus up there to make me a member of certain society. I'm a member of Saham. So I hope that you know this society. If you're interested to join, you can be the associate members. Because this society, there are functional doctors. We are very open-minded doctors. We like to learn from all over the world. That's how we get a lot of information. So this society is called Society for the Advancement of Hormone and Healthy Aging Malaysia. So you can write it down, called SAHAMM. Capital letter, you Google. You can be a member to increase your medical knowledge. It is not just drug. It is a holistic approach. So we have our WhatsApp groups. We talk about diseases like this. We all of us are struggling. All of us are frontliner facing same problem. And there again, there's another group called Muffin. So these are the groups we now lobbying a lot of new guidelines for doctors to learn to change so that to save our patient life. So Muffin stand for Malaysian Association for Advancement of Functional and Interdisciplinary Medicine. So these groups of doctors are doctors that like to be different in the sense that we want to treat patients holistically. We just don't want our patient to be a drug container. So I'm very thankful to be in the groups, so we get to know internationally there are many doctors, frontliner, they are physicians, they are teaching us. We have Zoom with them, how we should manage COVID patient differently. So every day, almost every month, we learn from many teachers. So under my hand, I have 5 of them. Each of them have their strength. So because each of the patient come differently, we have to manage them differently. But it's an art. It's very artistic. We learn through experience. That's why I say patients are my teachers. Teach me to become a better doctor. So let's say, now come back to this virus. What happened when this virus go into your body? A lot of time, we already try to cut down the load of the virus into our body through social distancing lah, hand washing lah, mask lah. The whole main aim, even some of the spray lah, is to reduce the viral load. It depends the amount of virus that enter into your body. Normally it's through inhalation or direct contact, especially to your eye. Because this virus can penetrate into your mucous lining. So the moment when this virus stay into your lining, in your mucous membrane, of course you have a layer or protective mechanism to get rid of them. But somehow, if they manage to go into your system, you have your immune system Then of course, when you want to talk about immune system, there's another big topic lah. It's our body terrain. That's where the seven parameter of wellness that I always love to share with people, basically is to increase your immune system. Today, we are not going to talk about it. I just share roughly what happened to this virus for the first 7 days. So from my experience, all this my own experience, my own sharing. So you can listen, then you can discuss with your own personal doctors. When you have some doubt, you can talk to other doctors and to share. You see, because this is a very new disease. We all learn at a different pace. Different doctors treat COVID differently. So what happened when this virus enter our body? We have many army in our body. All this army, there's a first liner and there's also a second liner. We are pretty very layman. Of course, there are a lot of scientific words about it. So for us, when this virus go into the body, it will start replicating. From the first day to 7 day, roughly. It will multiply, use our own cell to multiply. So our main aim is to activate our army, our policemen, to catch them, to get rid of them. So, of course, there are certain nutrients that can help us at this time. That's where you used to hear people say, vitamin C lah. Yes? You used to hear people say, vitamin D lah. Use zinc lah. All this is to activate your army so that they can catch this virus, to get rid of them, to reduce the number of this virus in our body. Because now your body already become a war zone. Now they are playing inside your body. Your body is trying to get rid of them. So the first thing is you need to activate your policeman through your nutrient. And then for the policeman to be active, you need heat, you need water. That's where when you are sick for the first 7 days, you really must drink a lot of water, hydrate. You need to sweat. You need heat. If you have fever, don't automatically go and take Panadol, to bring down the temperature, unless you cannot stand the pain, the discomfort. If you can stand it, let the heat be there. Because the heat will hasten the movement of the circulation. And then your army will move very fast to catch them. And the heat will kill them. Anything above 60 degrees, more than 20 minutes, the virus will die. So that's why when my patient down with COVID, the first 7 days and the subsequent days, we want them to sweat. Whatever mean. The easiest one is to soak your leg in the ginger boiled water and drink ginger water. You really have to sweat. First thing, to increase the heat. Number two, during the process of sweating, you are cutting down the toxin in your body. Because you are going to another stage, that is stage 2, your body will start to have a lot of reaction to the toxin and leftover of the war. So you really have to reduce the toxin at the end of the day 7, day 8. Then you will not have a lot of reaction later. Because a lot of people have these COVID troubles on day 8, on day 9. that was the time when there's a lot of toxin build up in the body. So we don't want so much toxin build up. You really have to hydrate. You really have to rest. Because when you rest, your detox system will come in better. You really need a lot of hydration. And then you have to alkaline your body. What do you mean alkaline? So I always tell my patient, when you're sick, this is the time you have to take a lot of colorful vegetable in the juices or in a smoothie, or you buy vegetable powder, you mix and drink to make yourself alkaline. Because when your body is alkaline, the flow will be good. And during this process, when this virus is replicating, our body will produce a lot of fibrin. Fibrin means our body system become thicker, stickier. So that's why in our COVID treatment, we will have blood thinner, especially to the senior people. The circulation will be full of a lot of fibrin. And this fibrin will slow down the circulation. And you need a lot of minerals at this time because your body will be very acidic. And in order to maintain your body pH, you need minerals. That's where this bamboo salt come in. It gives you a lot of magnesium, potassium. That is very important to alkaline your body. So whenever you are sick, you need to have all those things in the house. You need to have bamboo salt. You need to have vitamin C. You need to have vitamin D. You need to have zinc. Certain patients might need, especially they are a bit old, I will have some homeopathic solution which will boost out the immune system. Boost up, make the army in the body stronger. Young people, I do not give because they are very strong by itself. But if it's a senior people, like lately I see one 87 years old ladies, I must give her. So I really very thankful I get to know a medical doctor turned homeopathic. He has a solution to increase the immune system. He also has a solution to reduce the oxidation of the body. And it's not very expensive. That is the good thing about it. And then, of course, during this process, you need to open bowel. So these are the points that you have to do it in the house. That will later make sure when you reach the peak, you will not have a lot of reaction. Because a lot of problem coming on day 8, that is where the what we call cytokine storm come in. That is the time where there are a lot of debris sit in your body. There's this one physician sharing with us. It is like if your body is allergic to this toxin, you will have a lot of reaction. That is the time it causes a lot of damage to your organ, especially the lung. So when you reach the stage, we will have another medication to reduce the inflammation. Does it sound complicated? Can understand? Can, So, then that is the 7th day. When the 7th day over, most of the virus already dead in the body. That's why normally isolation after day 10, you are not infectious. Someone need to be safe, they can go up to day 12. But normally about day 10, even you do your swab, is positive, we consider you are non-infectious. Because the swab sometimes can be a dead debris of this COVID virus. So nobody will bother, after 10 days go and do the swab again, see whether it's still there or not. It's only first you want to confirm it. But some of my patients, when they symptomatically, they present with all the COVID symptoms, I don't even bother to ask them to do the test. I say you keep the money, use it to boost your immune system. Unless you are the type you want to be very sure, then you go for the test. Otherwise, at this moment, you have to treat yourself as COVID. You have to isolate yourself in the house. Almost guarantee 100%. If you are down with whatever symptom that I share with you. That is the day 8. Normally you see whoever gone through the COVID, they will take many tablets, because steroid tablet. It can range from 8 to 3 or 4, depend on the condition of the patient. That's why steroid can save life when you know when to use it. Cannot simply use. You need to know the timing. That's why when you have COVID infection, the first day of your symptom, you must know. Because you cannot simply use your steroid. If you use too much steroid too early, you suppress your immune system. We only use steroid high dose to save life on day 8. That's what I learned from Dr. Sankara Chetty from South Africa. He has treated more than 4,000-5,000 patients. No one get admitted with his method. I'm very thankful for him. So, must remember steroid. Whenever we hear steroid, we are very scared. My patients say, you give me so many. I say, yes, you must know when you need it. You see why hospital using so much steroid. We doctors are very bad. No, we doctors want to save life. It's because the person use so much of their own steroid, the body not enough to cope the inflammation of the body. That's the time you really have to use. You don't simply use for certain reason, but you must remember when you can use it. Cannot use it too early, cannot use it too late. Because it can prevent damage. It can prevent cytokine storm. Cytokine storm is a lot of reaction in your lung, causing a lot of scarring. That's where you will have a lot of this respiratory symptom, difficulty in breathing. Basically, with the oximeter, it will drop. Another thing that I would like to share about oximeter is, whenever you do some exertion, like today I've got one patient, he called me, he said, hey, my oxygen go very low, below 90. Below 90 is serious. I said, what were you doing at that time? He said he was taking his bath. So when he was taking his bath, he exerted himself. His heart rate is a bit fast. So when his heart rate is a bit fast, his oxygen level will drop. Then after that, I said, when you rest, what happened? Oxygen go up to 92, 93. So don't worry, because this guy is on the day 6 now. Day 6 and day 7 is the worst. It's the time before you reach the peak of the mountain. So with all this protocol, I find out the whole idea is you need to institute early treatment. don't worry, don't be ashamed of getting COVID. It is just like cough and flu. Everyone can get it one. So the moment you get it, you don't hide yourself, don't isolate yourself. You must call for help. Like you go to mountain, you're going to climb. You need a good mountain guide to guide you through. So the mountain guide is doctors who knows COVID very well. He will guide you through. Seek treatment early. That is the secret. Don't wait, until you have difficulty in breathing. Only you seek hospital admission. By then, from the statistic 25% dead. 1 out of 4. So the whole idea is early treatment, no hospital admission at the end. That is the take-home message. Must remember. The whole course of the treatment, I can tell you, if you take 2 weeks, if you are young and fit, we don't want to talk about supplement, the C, the D, things like that. It will cost you 200-300 only. And it's about 12, 13 different type of medication. You don't treat yourself. Okay. Then, of course, there are people now is asking about what treatment we give certain things. Now very hot. Ivermectin. Ivermectin is only one type of medication. I'm not selling it. I only use it to save my patient life. When they need it, I give. I get them to sign consent form. I want them to understand I'm using it. If she believes it, I give it to her. Because there's a lot of proof. You can go into, there's so many YouTubes. Dr. Jackie Stone from Zimbabwe. She's also one of my teachers. And they are from very poor country in South Africa. And she's been treating, she's a frontliner. She's been treating so many COVID patients. So far, she lost one patient. And that one patient she lost, it was last year before Christmas, is when this patient came in very late. She lost one. And she's using multi-pronged strategy, which is very good. Just like the way we are treating HIV. If you well versed with the treatment of HIV, last time when HIV just started, we doctors among the medical world also cracking our head. We cannot treat our HIV patient with one drug. It has to be multiple drugs. So you don't treat yourself with just ivermectin only, please. You want prophylaxis, you follow FLCCC prophylaxis protocol, which you can download from YouTube. Every week they have update. This is from American Frontliner. You read yourself and you judge yourself, because there is no conclusion yet that it is. You ask me to use, not to use. You have to read and to find out more. But my experience is ivermectin is one of the very important medication, but it's not the only one. Must remember that. You have to use multi-regime. We have to use antibiotic. We have to use a lot of antihistamine. Sometimes we have to use blood thinning, depend on the situation. We have to use some of these so-called formula because I'm exposed to homeopathy. So I start homeopathy class because of COVID. I have a very good teacher from India. So he is treating a lot of his patients, very good result with homeopathy. He was a medical doctor and turned homeopathic. So that also opened my eye into another world, medical world. And then people come ask again about some of these Chinese herbs. I think now many people know about it, right? I would say that if you look a bit more detail about this Chinese herb, basically it helps you to clear your lung debris and to clear your body toxin. It creates heat. It makes you open your bowel better. So it does help. If you believe it, you can buy some of these herbs, but you make sure you buy the genuine one. As a tea, they call detox tea. I find it quite good also. So you can add into it. These are the additional one. So the whole idea is when you are down with COVID, please seek treatment from doctors who are well-versed in treating COVID, because different doctors, they treat differently. Now come my personal experience, how I go through my COVID experience. I'm sure you're interested to know.
Yes,
So
yes, I think,
it started 13 July. I was supposed to do a juice fast and liver flush with my friend. Actually, very thankful to them. They didn't even know that actually I was down with COVID then. And until now, I think today probably they will know. They have not questioned me, why am I not supportive? I supposed to join them, but I didn't do it until now. My set is still with me in the house. So I apologize for the other two friends who have done it. I have not responded to them because for that next 2 weeks, I will just work and sleep only and sweat and hydrate. So what happened was, I remember that day, I was actually having a long talk to one of my COVID patients through phone. Then that evening, I noticed I have dry throat. And then I have a little bit of a dry cough. I felt my body was warm. That was the first day. And then subsequent 3 days, it was similar. I was on FLCCC protocol already, earlier on. So when I know that I'm down with it, I take daily Iver plus others lah. Then I have loss of smell. You ask me whether I do the test or not. I didn't do. But the symptom tell me that on day 5, I couldn't smell. I used to do flower energy every morning. But this time, how come I cannot smell? 2 days later, I lost my taste. But the very obvious one was the feeling is just like I'm climbing Mount KK again. I couldn't walk very fast. The moment I walk fast, I feel I'm out of breath. I couldn't talk very loud. My energy was very low. And I have low back pain on day 8. There was a time it's telling me my antioxidant was very low then. I need to add something lah. That was on day 8. I have to use steroid tablet, 6 tablet on that day 8. And this is my whole life. I can tell you that the most medicine I have eaten. I have not made friends with medicine for so long, for at least more than 15 years. But this time I have to take medication. I was down with cough, with a lot of phlegm, and the phlegm is very mucus. I need to take 3 days of antibiotic. At the same time, I was an asthmatic child before. So my asthma have not appeared, but I find my chest was very tight. But there was no wheezing on day 8. So I have to add some homeopathic drug that's supposed to help me to increase my lung surfactant and to increase the so-called IgA to help my lung breathe better. Because the steroid will reduce these 2 components in the lung. So if I find it works so well, after 2 days I was on it, plus antioxidant medication, which is not medicine, more on supplements, I came out very nicely. But the last thing for me to feel normal, that is after 21 days. I'm back to normal self. So what I do was, the first thing when I know I'm down with it, I have to keep myself calm. I need to have a plan. So what I do is, for me, I pray for strength and endurance. I know He is up there, is in charge. That's the first thing I do. Number 2, I have the plan. Then, that journey to me is like I'm climbing Mount KK. I don't know whether you have climbed Mount KK before. It's 3 times the journey. You imagine? 1 time up and down is about 5 days. From the plane to back. So this is about 3 times. You have to be very patient. And you know your plan. You walk day by day. You need a good mountain guide who knows that you have some injury, what to give it to you. But for me, physically, basically, it's exhaustions. What I do is I shorten my working hours to 5 hours. I try to see as less patient as I can. That's why I must thank another good friend of mine who keep wanting to see me. I say, no, please, if you're not urgent, you don't see me. You only see me next week. So they are being very understanding. So they see me because I see more of patient coming for wellness. So they are not urgent. What happened is, during the climb, I need to assist other climb together with me. So that is a bit more draining to me. If you can, you rest. Then you might wonder whether my clinic assistant are affected or not by my situation. Until now, they do not know. Actually, I experienced through. None of them have COVID, but they are on FLCCC prophylaxis protocol, except one very young girl who refused to follow the FLCC prophylaxis protocol. I told her the moment you have fever, you cannot come to work for 2 weeks. True enough, before I had the COVID, she was down with fever. And until now, she has not come back to work, but she's okay now in the house. But the other two girls, my senior girl, they follow this protocol, which I give them free, including their spouse. Even their working spouse, their company also have COVID positive. Their bosses want them to do the swab test. Thank God they come back all negative. Until today, they are all negative. And what happened was, all my children in the house are also on FLCC prophylaxis protocol. And none of them have COVID in my house. And of course, I take precaution. If I'm in the house, I isolate myself. I wear mask also. Then 5 days later, my very good kitchen assistant down with similar symptom like me. She too go through the same process, but she only need to take care of one person. That's me. So she lost 2 kilos over 2 weeks. I lost 4 kilos. Now I'm getting back 1 kilo. I still need another 3 kilos to get back my weight. But one thing is, I'm very thankful for my husband. At that time, he was away. That solved a bit of more of my problem. And I also very thankful that he's calling, how are you doing every day? I'm very grateful for that. I'm also very grateful for my clinic assistant that I can really see, at this time, the clinics are actually facing a lot of these COVID patients come into our clinic. They are brave enough to make sure that I can actually still run the clinic in whatever situation, whether they go for vaccine, the next day they are not feeling well, I'm trying to help them. So you really can see, that the royalty is there. And I also very thankful for this precious experience, that at least I can understand, the whole experience of getting this COVID after all is not so scary. As long you know what you do, you stay calm, then it will be okay, you'll be fine. But one thing you realize that when you are down with this, you will notice that how fragile is your physical can be. You will really have to sleep and sleep and sleep. It's very exhaustive. It's very draining. So that's why until now, I have to optimize my hormones back again. I have to increase my normal level a little bit higher to feel back to normal again. And only one very thankful thing is to my patients. They become my teacher along the way. For this 1 year of experience with this COVID, they become a very good teacher of me to learn more how to treat this COVID patient and to save more life. The other thing is also I'm very grateful is once you have this natural infection, you get this natural immunity for life. That's why I read from Dr. John Campbell. You can go into YouTube and see he has a lot of study talking about antibody form acquired naturally. So after all, it's not something scary that you should be scared. Of course, you take precaution, whatever is recommended by the governments, practice it, by our KKM, but you do a little bit more because all of us are learning. KKM is epidemiologists. They are not treating patients. They just want the people to be out from COVID fast. So they have a different perspective of thinking. But we GPs, we are frontliner, we are seeing patients directly. We need to help our patient to come out from their present problem. Thank you for listening. If you have any question, you can always ask. I'm always glad to answer.
Okay, there's one question
Yes.
from Heng. What is Dr. Tan's view in the new Delta variants? And it is more deadly and very infectious. Can we still cure homeopathically if being infected?
Yes. It's just that they are a bit more infectious. You have to follow the step that I share with you. It's just that maybe you have to take a bit higher dose of medication. But still, the whole idea is treat early, start treatment early, do homework. It's not just homeopathy. It is a multi-pronged strategy, multi-regime. So the whole idea is before you embark this journey of climbing, before called to climb the mountain, to reach the peak at day 8, before you need assistance to come down, you prepare your body, Terence. Increase your immunity through all the 7 parameters of health. You need to make sure you hydrate well, you have enough minerals in your bodies, you have enough rest, you alkaline your body, you make sure you exercise, sunlight, you open your bowel every day, reduce the toxicity in your body. These are the good habits you can calculate. You don't wait for COVID to come into your body before you start all this. Sometimes can be too late. If you have some financial budget, go a bit of some basic nutrient to boost out your immune system, at least vitamin C. That is the minimum. You have more budget, go D, go zinc minerals. Then if you are the type that need to go out and meet a lot more people, because you have to work, your work nature, maybe you need to think about FLCCC prophylaxis protocol. That one is optional, it's up to you to decide. I'm just sharing from my own experience. So whatever viruses, bacteria, fungus, if you really study your whole bodies, all these foreign organisms, their genetic makeup is more than our genetic makeup. Your gut itself is already at least 3 pounds of this microorganism. You do not need to worry of them. We live together symbiotically. But there are a bit more we find where our body is created by someone up there to able to cope with all this. But when you're sick, you need a good mountain guide to help you to walk through the path from the foot of the hill, from the mountain, go up the hill, you reach the peak. When you come down, you need assistance. Of course, you want to feel a bit better. You can correct yourself, optimizing your hormones, because all this also play a part in immunity, in energy. So this is another department. So you go layer by layer. It's not something like, you do it then and then because it's not on time. When you get sick, everything must be there already. So if you have a little bit of financial mean, do something about taking care of your own body health. Don't wait until you are called to climb the Mount Kinabalu without preparation. You see, you take how many months before you start climb the Mount KK? You prepare, right? I remember I spent 6 months to prepare myself physically.
At least 3 months.
Before I climb the mount.
Yeah. Okay, there's another question. By
Yes.
Kong, do you still recommend vaccination?
This is, as I say, there is a good and the bad. You have to decide. The good, now they see outweigh the bad from our KKM. There again, if you look a bit more detail, you have to decide. It's very individualized. But our health ministry look at this as a whole in terms of acute management. To look like the advantages is more than the disadvantage. I can share with you a lot about vaccination issue. We can scare people. We also can see people who have a benefit of the vaccine too. You have to decide. I do not recommend. I do not say no. I do not say yes. You have to decide because you have to read. You really have to read. It's a very sensitive issue. There are two groups of scientists there.
Okay.
One's against, another one's very pro.
Okay,
All
got it. Thank you.
different agenda.
Thank you.
I
Next
cannot
question
answer you.
by Caloring Chin. What would you recommend for us as a precautionary measure in the event any of us exposed to the virus through a close contact?
That's why you read up the FLCCC protocol. It's stated there. One of it is ivermectin.
Okay, thank you. Next question by YS Lee. After completion of 2 doses of vaccination, is the antibody test currently available in some healthcare centers? Really
Yes.
recommended or accurate in nature? Kindly
Yes.
comment. Thanks.
You can do the test about 3 months after the last dose of vaccination to test the antibody for the COVID. I think it costs about 200 plus a test. But you need to do it 3 months because your body needs about 2-3 months to build the antibody. You off the last dose. There are many lab doing it actually.
Okay, thank you. Next question by Sue. It's not a question. I'm COVID patient day 5. Food soaking
Yes.
still need for me?
is important. You need to do leg soaking as long as you want. Because what is the whole idea of food soaking? Basically, is to soak your leg to make yourself warm so that you sweat and you also increase the circulation. So basically, if you are day five, the virus is still replicating. There's still a lot of fighting in your body, you know. They're still producing a lot of acidity, toxicity there. So what you want to do is to get rid of this toxin, to improve your circulation, to increase your immune system. So you need to do that even or after day 8. Because the day 8, there's where the toxicity come in. You can still continue using it, but you make sure you have enough minerals. It's either the liquid type or is it the bamboo salt? I find it's very useful. The 9-burn one. It's very alkaline and loaded with a lot of minerals.
Okay, thank you. Next question by Pek Chu from Panarimban. Can you recommend the dosage to take for vitamin C, vitamin D, and zinc?
Currently, the vitamin C again depend on what type of vitamin C you are taking. It can range a big range. But basically, if you can take 3,000-4,000 a day, up to even 6,000 a day, there's not an issue. Vitamin C is very safe. Again, you have to look at this, what type of vitamin C, because there are certain type, they are very liposomal one. You very small dose, it go into your body very fast. That one you can take lower dose. So whichever vitamin C you buy, if they recommend you to take 1 day, you triple it, it's very safe. The only side effect if you overload your vitamin C is when you have diarrhea. That means when you take the vitamin C, you have diarrhea, then you know you already overload your vitamin C. Vitamin D, the best is from the sun. But if you want to be very sure that you have enough vitamin C, you can do a blood test to see whether you have enough vitamin D level or not. That's one way lah. But it's quite costly to do that. It costs you about $180. If you don't want to do that, at least you take the vitamin D with the K2. Remember, you must have the K2 with the D. Because otherwise, there's an increased absorption of the calcium. The deposition of the calcium may be too much to the abnormal places. You need K2. So normally, as long as you're not taking more than 10,000 IU, but the recommended can be 4,000, can be 6,000, again depending on your body level. But as long as you're taking not more than 10,000 IU, a day is very safe. Not more than 10,000 IU. As for the zinc, I do not personally like to take the capsule. Of course, there's this 50 milligram capsule zinc you can take. Sometimes it can be a bit irritative to your stomach. What you can do is, bamboo salt is very good, it's full of zinc. So you can either take zinc from the bamboo salt or you can take zinc as it is in the capsule form. You can get it from Life Extension, which you can order yourself through iHerbs, 50 milligram a day. Okay?
Okay, thank you. Next question. We go for simple question first. By Heng. Could water fasting help to kill COVID virus?
I'm thinking, what does it mean, water fasting? Water fasting means you are doing spring cleaning. Okay? When you do spring cleaning, you are going to flush out a lot of toxin from your body, fatty layer tissue into your circulation. You need a lot of energy to do spring cleaning. So to me lah, it is not the right time to do water fasting because you need a lot more energy to do water fasting to get rid of the toxicity. It is your body already become a war zone. So during the war zone time, you have to make sure your immune system is up. Your energy will be channeled into your immune system. Channel into getting rid of toxin. You don't want some more extra toxin. But water fasting is good when you are at the very relaxing time, your body is at the optimum time, you want to do some extra spring cleaning, do it. It's very good, but it's very cold turkey lah. I prefer vegetable juice fasting. For me lah, personally. Of course, the older you become, you go water fasting, there are a bit more challenges. But if you love it, if you can take it, that is one of the parameter when you're well, is a very good practice.
Okay, next question. Leslie, you want to read it out?
Okay, from Joyce, a question from Joyce. After a patient got COVID-19, when can they take the second dose of vaccine?
From what I read, normally after a month. But I personally feel if you're really sure that you already have COVID, you already have your antibodies, I'm really not sure whether the second dose of vaccine is necessary or not. But it is our government policy is whether you are positive, you are negative, all must get. I find there is a blind spot there. You have to decide, but it is, if you follow our KKM policy, normally they will leave you for about a month or so, then you take your second dose. They will postpone it for you.
Okay, thank you.
Okay, next one. Okay, next one from YSD. Could be a COVID victim be infected the second time after he or she has recovered earlier? Is the implication more serious?
You see, when you have a COVID infection, you already develop the antibody. But this COVID, they have many variants. Just like, I'm not sure whether you have this experience of some of these hand, foot, mouth diseases in children. There are many types also. But they say there is some cross-reactivity. That means if you already have one COVID, the next COVID, if you really exposed to, the severity will be less. Because whatever antibody you have now, it can help you to cross activity to produce antibody, but probably of different type. I really don't think it's going to become more serious. I would think it become better, milder. If you already have antibodies, just like I'm not sure you remember, I can't remember exactly what year, I think 1987, there is the COVID-1, SARS-CoV-1. So they have done study, people with SARS-CoV-1, they had the antibody of SARS-CoV-1, which they was infected many years ago. Now when they have this SARS-CoV-2, they found out there is cross-reactivity, and these people do not suffer so much at this present COVID so much. I mean, these are the correlation. This one I read from Dr. John Campbell. You can read more
thank
about
you.
it.
Yes, thank you. Now we change style a bit. we hold on the question. Can Karen share your experience?
So
Okay, I listens to all these questions. So I just want to pull you back in between your idea about your questions in terms of practicality, put yourself in the shoes. Okay, I am someone technically does not diagnose with COVID positive technically because I didn't get my COVID test done since day one until now. Last Saturday, I completed my second dose of vaccine. May I seek your permissions to give me a few minutes to share my experience? Okay, first thing first, I'll urge everyone to be very alert, to be very alert and to be very open, okay, and stay very positive. If you see or feel anything about your body, okay, acknowledge it. Any sensation. First, tiredness. Somehow, over time, your energy kind of reduces. Second thing, you will feel your stomach a bit click clock one. Only air only, like irritable bowel syndrome. It's like normal gassy thing only. Nothing much, no? You go not loose tools, not diarrhea, it's like clap. So I'm talking details, detailed symptoms. I hope it benefit you. First of all, I feel a bit tired. Over a few days, the tired is getting much more serious, much more tired. And then take note of your stomach. I think very early stage, we discussed with I discussed with Dr. Alison. Dr. Alison asked me about what happened to your stomach when? I said, yeah, one of the midnight, the stomach is a click clock. It's like gassy and that kind of thing. It's like irritable bowel syndrome, IBS. But that is no diarrhea, no tools, no nothing. But it's just like gassy. So you recall, no? I recall what I have taken. But I've been very disciplined eating at home. I don't really eat meat at home. Yeah, I only eat vegetable at home. Occasionally, I tapao meat. Yeah, so it's quite disciplined. But somehow I have that kind of symptoms. So couldn't bother tired maybe, over Zoom, over the internet, too long hour kind of thing. So kind of take it easy. And then suddenly I felt the tasteless in my back of my tongue. The front of my tongue is still okay. The back of my tongue is like suddenly no taste. Then I called Dr. Peter. No? Suddenly no taste. I say, wow, maybe lucky strike. I say, yeah. So I called Dr. Alison. That was one Friday night. Yeah, we are still having our Supermind. So I make sure everybody is in. Yeah, I didn't tell you about the story as like Dr. Alison didn't tell anyone. Okay, so I make sure all the students are in, all are in order. So I told Leslie and Peter, no, I'm going off because I'm calling Dr. Alison. Okay, so any one of us, especially in Klang Valley, I tell you, is getting so serious in Klang Valley, is in the air. It's in the parcel that we're receiving, even you're not going out. I can tell you I don't go out at all. I don't go out at all. I don't even go out and pack food sometimes, I kind of minimize it. But I receive parcels, okay? So that is my daily routine. At home, everything at home, but receiving parcels. That is my lifestyle, okay? So if you are receiving parcel, make sure you desanitize everything or leave it there for a while before you get it in. Don't get too desperate over your parcel. Okay, and then the next day, without waiting for the test to be positive or negative, don't wait. This is what I'm going to urge you. Don't wait for the test to be positive or negative. First thing first, when you have the symptom, when you feel a little discomfort, you should boost yourself up with high vitamin C, B complex to boost your energy, because you're talking about water fast. Let me tell you, when you are actually having that symptoms, your strength or your energy kind of drain down so drastically. You cannot, or you have no strength to do even water fasting or even juice fasting. You must have ultimate mental strength. I remember first day when Lala Move get me the medication from Dr. Allison's clinic, and Dr. Allison asked me to eat clean. Wow, I really eat clean. No, I'm very obedient patient sometimes. Sometimes eat clean. I tell you, the whole day, wow, everything also cannot do. Sleep also, like sing, go sing, God sing, everything, because the medications kind of like overload my body. Because I cannot take a lot of medication. So the minute I take a lot of medications inside, wow, the first day go haywire. And then the second day, you can see my Facebook. Wow, I was like having colorful salad, one whole bowl, and everybody is asking me, are you sure you are eating that by yourself? I say, yes. And after that, every day, I make sure I tell my mind I'm fit enough to cook good food for myself. I have heavy load of, I lost my taste, but don't feel like eating, but somehow I force myself to eat. Force feeding is because I know I have to load myself with medications. Okay, so you don't doubt about the medication or the side effect of medication. You have to save your life first. The rest of the detoxifications can be done later with no liver flush and all that. No, so stop all that thing first. First thing, you make sure you have enough energy, or I make sure at that time I have enough energy, because the first day itself, I know I'm KO. The tiredness is just so different. So different, The minute you sleep, you're like that, pop. The minute you wake up and eat, and if you feel like having 2 hours of Zoom is almost impossible. You need to go to bed immediately. Went to bed immediately and KO. So, but I'm very disciplined. Of course, the medications, and I take very high dose of vitamins according to Dr. Allison's advice. Even the night before I get my medications, my vitamin D is at 25,000 IU. This is something like a bi-weekly dose that I'm taking daily. Okay, the 2 weeks dose I'm taking. I have the lazy dose of bi-weekly dose, one dose to last for 2 weeks of vitamin D. I kind of take it daily. Okay, vitamin C, we are talking about hourly. Regardless how high your vitamin C is because it's water soluble. So you can take as high as me. Every hour, one vitamin C. Okay, vitamin B is also quite high dose. I kind of like taking double or triple. Instead of once or 1 tap or 2 tap a day, it's kind of like 1 tap or 2 tap after every meal. It's kind of like 3 times. Okay, and then mineral salt, bamboo salt, the 9 roasted bamboo salt is like, every time I drink water is either lemon juice or bamboo salt water. Okay, and one thing about me is that I'm very lazy, and I tell you, in fact, to exercise at that time, you must have ultimate strength, because my body really weakened. But quite lucky that I have a thermal heat spa at home. I have a blanket, the heat blanket, even though it's very old, it's 10 years old. My parents bought it, but I get to enjoy it at least at that time, to make myself sweat. The first 1 week, I can tell you, sometimes I sleep almost twice on that thermal bed. I remember the first night itself, because I kind of like acknowledge my symptom at Friday evening. I sleep on the thermal bed while waiting for my medications. That is how early. This is what I want to bring up to you. It's not because I'm a COVID diagnosed or not diagnosed, or whatever. I'm just telling you that how fast you should treat yourself, in what way you should be treating yourself, rather than waiting for all the papers to kind of like, yes, acknowledge that you are, yes. And again, why I didn't want to let people know is because you have no energy to explain to anyone. Because people will ask you, hey, why you didn't check positive, negative? You straight away go and eat this medication, you sell all this. Hey, this. I tell you, stop all that kind of nonsense. Not to say we don't want to let anyone know. It's because your strength is strictly for your own survival. This is how important. Not to entertain and answer anyone. They don't even understand. Even a lot of medical doctors, sorry to say that, they don't even know. They haven't experienced for themselves, and the protocol are different. So if you want to follow, or again, not to say you want or you don't want, sometimes we just don't know what to do. But what I can tell you is clock are clicking. You must be detect your own system. You must be sensitive enough to detect your own system as early as possible. If you do not have the medication while waiting for medications, you need to take high dose of CBD. You want to hantam E also can hantam E lah, okay? E lah, bamboo salt lah, whatever that bring you energy, whatever that bring antioxidants to your body, you need to sweat out and detoxify. Okay, and stop listening or answering the unnecessary, because there's no way you can explain to them, why after you recover, why you take so high steroid? I'm taking 16 tablets of the steroid. So people, wow, 16 is a lot.
Okay, I continue.
Okay. Yes, I think.
Can I share my experience while waiting for Karen to come back? Karen, you want to continue?
No, Peter, continue.
Let's
Okay,
rest a while first. I think the 16 steroid is very, very powerful, you see. Okay.
So,
Peter,
for my side, I'm more on preventive lah. I'm lucky because I stay in Tanah Rimba, Jalan Baik. It is a mountain with a very low density. So what I did was I walk every day, at least half an hour, and then there's like less people around, or I exposed to sunlight more, where less, there are no people. So exposed to sunlight for at least 1 hour. That's why you look at me very black. And then I take ivermectin 1 piece per week, 1 week once. And then I like to eat meat, but I add more vegetables. Now a bit more vegetables, less meat. Still take the chicken, all that. Still got, but less, much less now. That's what I do as a prevention. I have sore throat on and on, but I don't know whether it's COVID or not. When I have sore throat, I take bamboo salt. Just gargle and so on. It's okay. So far, that's what I was doing as a preventive.
Your sore throat is due to durian, not due to COVID.
Sometimes they are organic. Okay, once a while, not all the time. Okay, Kerry, are you ready to continue your story?
Yeah. So first, you must have good faith about yourself, your psychological, your mental strength. You must just tell yourself that you have to be mindful with your body every minute. How is your body sensation? You sweat, after you sweat, how more alert? Then you're telling yourself, after sweat more alert means correcting. So the minute you are kind of like very tired, I rehydrate myself with a lot of bamboo salt water, then I go and sweat again. Because I know, I recognize it's something, I feel good, that's the right thing. My body is telling me. Okay. So after the 6th day, the 7th day, I contacted Dr. Alison's. Okay, seems to be everything under control. Okay, then to follow the second set of medications on the 8th day itself with the steroids and the aftercare. I call that kind of like, that is stage 1. So this is stage 2 of aftercare. where there is a lot of residuals of COVID is in the body. Okay, so since I had followed through, so I have good faith in Dr. Alison's style because I'm also under her for the rest of the general wellness for I think since last December. Okay, so at the meantime, beside having my COVID medications, another set of vitamins, one set of routine. I also have my current hormones therapy very intact. Okay, that is for female at my age. I still have my hormone therapy very intact. After that, the high dose of steroid, talking about 16 or 18 tablets a day. Yeah, so it's no joke. Yeah, those who get scolding from me on the second week wonder, this woman why you are scolding. Then later I kind of like call Dr. Peter Ye and I apologize. I just say that no, I kind of reckons the side effect of steroid, but to me I think it's okay. It's because of course it's overdose or whatever is not for the fun of it. Is because there's for a purpose for the residuals or whatever COVID in my body. Okay, so after the second week, went to Dr. Alison's Tan clinic for a blood test. Okay, the blood test seems to be all good, and subsequently I go for my first jab, and I can tell you, even though after I gone through the first dose, and then last Saturday my second dose, in between, beside my tongue get numb or tasteless, after all the treatment, the numbness or the tasteless remain. I didn't get back. In fact, it get worsened with the nose. I have burned a few pots at home. I think Leslie know, sometimes meeting halfway, I say, hey, wait, I go and the smell is like so strong, the whole pot is like burned for a few hours, then I can smell. So I have sacrificed a few pots at home. Yeah, I almost have to go online and buy pots because most pots have cracked, okay, except one cast iron big pot that still remain, but I have burned a few times because the sensitivity really reduced. So I try to cook more colorful food, more spices in my food to induce, but I think now it's getting better. So you asked me whether COVID's jab helps. After my first COVID jab, I kind of like gained back my smell. Okay, this is my personal experience. Nothing got to do with whatever. Yeah. After my first COVID jab, my smell is kind of like good. Come back. I still remember I was conducting an exchange workshop. In the morning, I text Leslie. I say, hey, just help me to come into the Zoom section as host earlier to admit people in is because I need to go for my sweat spa. Is because I cannot, the nose like blocked. Besides, cannot smell is like blocked. That was after 2 weeks. I still have a little symptom here and there, but kind of cope with it and talk to my mind, talk to my body, how, that kind of thing. So on and off, I call Dr. Alison. I say, still there, but the rest is all good. Tiredness, yes, just now I just also knock off. I was late for this. Sometimes the tiredness still remain, whether it's my own or what. Yeah. So that one, the recoup side, I have to build up my stamina and so on. So right now, technically, I'm still not COVID positive, but I have walked through. So this is as much as what I can share with you, because it's not to get yourself positive or negative. The most important thing is get yourself survive and get yourself healed. Get yourself healed and make sure you survive. The minute you delay for another 2 days, I can tell you it's a world of difference. We tell you it's so easy. Dr. Alison Tan to tell you it's so confident, it's so easy, provided you detect. early, you go to Dr. Alison Tan early, or patient go to her early. You don't wait, yes or no, until you get positive 3 times. Then suddenly, I think the physical condition will just suddenly drop drastically. That's what I feel. That's what I feel. So this is my experience, and thank you very much.
Okay, thank you for sharing.
Okay.
About 11 o'clock already, maybe we need to put a stop, otherwise cannot stop. We have last
Yes.
round of what you feel like saying, Leslie.
Okay, I think we take one question first because I think this one quite important. Okay, so by Liao Hui Hui, so she asked Dr. Alison, I have severe allergic before, which is called anaphylactic shock. She asking, can I take the vaccination?
Then you have to find out what kind of anaphylactic shock. What is the chemical or the content? Because in the vaccine, there are some chemical in it. I'm not sure you're allergic to those chemical or not. So one way is you have to find out your anaphylactic shock to what chemical. If you can find out, it's the best. Otherwise, nobody knows whether you will get any allergy or not with this vaccination. Because there are few type of chemical, propylene glycol inside, or some aluminium, depend on types of the vaccine. So you have to check it out yourself, or before you go for vaccine, you call out the doctors, whoever you are familiar with, find out the content of the chemical inside the vaccine, whether you are allergic to it or not. So it's very difficult to answer. Nobody knows. But
Okay, thank you.
during the vaccine time, they normally will let you wait there for at least half an hour. I hope so. So that is a time that severe allergic happen. You can, they have this emergency trolley. It's actually quite easy to treat. I remember one of my patient, my neighbor went for it. She too has a very high incident of allergy. Until one time she was actually admitted for allergy to some of these bee products. So I remember she came over to my clinic. She got some of the allergic tablet just in case she developed allergy and the center do not have the means for it. She can swallow her tablet. That's also another way. But normally they will equip themselves with this allergic emergency trolley. It's very easy to treat for this anaphylactic shock. I think they should have it, or you can inquire from them. You say, do you have any emergency trolley around? Because they are very basic few medication should be around for allergy. Even in our clinic, we keep them. Because once a blue moon, you can never know who is really having this anaphylactic shock. You really have to have the jab on hand to save life. Because everything will just drop. Your blood pressure drop, no heartbeat. You will have to use certain medicine to bring it back again. It just work like miracles when come to drugs. Maybe you find out more from the center, whichever you're going for the vaccine.
Okay, thank you.
Okay, thank you. I think this important, so you can check with the said. I think before you check, I think they also consult you first. So they have the doctor say you have any special kind of disease or something then before letting you to jab. Okay, so I think what I feel like saying, I think just now when Dr. Alison Tan's sharing, so let me remember when during our younger times when we're having fevers, so we always I think go sweat lah, and then or go sweat and then put the leg in the water, all these kind of things. So and then this is something like I think so I feel like last time we are having fever or these kind of things are the same always, which is still important, and then when you cannot sweat, go to take the blanket and make yourself sweat, then after that, oh, okay already. So I think this kind of thing is still very important. So I think actually last time our parents and our aunts, grandparents, they have some, I think, learn this. I think this is a very ancient but very effective way. Okay, before we have having the Panadol coming in. Okay, then later then we doing that. So I think after the Panadol, sometimes you also go after eat your Panadol, then go and put on your blanket and then get sweat. Then after that, then your fever gone already, and everything get better. So I think this is something that I think some of the to boost or people see how our grandparents teach us to boost our immune system. Okay, but no theory, but very practical. So we don't know it, but I think they don't know it, but it's work. So I think this kind of thing is still thing. And then important thing is to do it early. So today, I think due to today is very important because we get new high today. So I think that's why I think we extend the timing, and then we also have some frontliner, I think first-hand kind of informations from Dr. Tan, so that we have more, and then also it's not that scary if you treat it fast. So I think with this kind of don't wait. I think important thing is just not don't wait. So just treat it as a COVID, and then start treating first. If you have a few similar system, I think it's confirmed already, and only go to test. But at least I think you start treating, and then before the virus spread, spread everything, you can start control it. I think then you can save your own life and your friends' life. Okay, so I think pass to Karine. Okay. I think 1 minute.
To Karine, last 1 minute we conclude.
Just
everybody 1 minute. Yes.
Just listen to your body and start treating early as possible. Okay, thank you.
Okay, thank you. Dr. Alison, 1 minute, last 1 minute.
Actually, COVID is very easy to recognize. Clinically, the symptom is all there. But the test is just an additional. Sometimes you can be test negative, but you're actually positive. So sometimes it can be positive, but it's the debris, but you don't have symptom. So basically, you have to follow your clinical symptom. Whenever you are in doubt, you call up to any of the doctors, especially doctors who are well known for treating COVID. So basically, I do see COVID patients through telephone. I spend an hour to each of them now, almost every day, at least 1 or 2 of them. We communicate through telephone. Through that, you can see that, they get treated early, they know how to plan, how they should go about, how to eat, what to do. So they're sort of being guided throughout the whole section. The whole section is about 14 days, up and down. The peak is at the 8 days for you to come down. But if you don't want to have this, they always call the long COVID, long haul, they call it complication after the COVID. I feel personally, it's either you have some more toxicity that's stuck in your body, which you have to cleanse, or your body do not have enough hormones. Like what Karen shared, I feel that you probably do not have enough adrenal hormone.
Yeah, that's why I thought, going for a blood test tomorrow to readjust the hormone therapy.
Yes. So your hormones,
the thyroid is on.
So it will cause a lot of this mucus discharge.
Mucus discharge. Yes. Okay.
And then you don't have so much energy. This is
Yep.
more towards the adrenal hormones.
Mm.
That is hormone, we always call it stress hormone.
Yes.
So in
Yes.
order for us to live well with a better quality of life, one of the modality of treatment is optimizing bioidentical hormones in our body. That will also help us to go through our old age with a better quality of life. Thank you.
Okay, thank you. Myself, I'll conclude tonight. So we are from Supermind Life Mastery Academy. We have weekly Thursday night 9 o'clock, and this is 95 week. Okay, so we focus on 3 area of life. One, health is very important now. Second, financial health, also very important now. And of course, relationship, especially family relationship, harmony relationship, using Supermind. So in health, today we're talking about COVID health from Supermind perspective. We look at nature, how your subconscious mind or unconscious mind think. If your mind inside there feel you are useless, you want to go. When the COVID comes, you will go. If you don't have that, you still a lot of things to contribute to the world, and you still feel yourself useful, a lot more things to do. You want to live. Even got COVID, you can survive. So don't worry. Okay, that's what I feel like saying. Thank you very much for watching. Good night, everybody.
Okay, good night.